What is Paracelsus? In the early 16th century, a man walked into the University of Basel, stood before an audience of students and physicians, and publicly burned the books of Galen and Avicenna, the two pillars of European medicine. He declared that his own shoe buckles knew more about medicine than these ancient authorities. He then proceeded to lecture not in Latin, the language of the educated, but in German, the language of the common people. His name was Theophrastus von Hohenheim, but he called himself Paracelsus, a name that meant beyond Celsus, a claim to have surpassed the great Roman medical writer of antiquity. This was not a man who believed in modesty. And yet, for all his arrogance and bombast, Paracelsus was one of the most revolutionary figures in the history of medicine, chemistry, and philosophy. He dismantled a medical system that had ruled Europe for over 1,000 years and replaced it with something radically new: the idea that diseases have specific chemical causes and can be treated with specific chemical remedies. Paracelsus was born in 1493 in the village of Einsiedeln, in the Swiss canton of Schwyz. His father, Wilhelm von Hohenheim, was a physician and alchemist who introduced his son to both medicine and the study of metals and minerals. The young Theophrastus grew up around mines and smelters, watching workers fall ill from exposure to mercury, arsenic, and lead. This early experience would shape his entire approach to medicine. While university-trained physicians debated the balance of humors in the comfort of their libraries, Paracelsus understood that disease could be caused by substances entering the body from outside. He studied at the University of Basel and possibly at Ferrara in Italy, though the details of his education remain debated. What is certain is that he spent years wandering across Europe, the Middle East, and possibly North Africa, learning from surgeons, barbers, midwives, herbalists, miners, and folk healers. He learned from anyone who had practical knowledge, regardless of their social standing. This was radical. In an era when physicians were scholars who rarely touched a patient, Paracelsus insisted that true medical knowledge came from observation, experience, and experiment, not from reading ancient texts. The medical system he challenged was Galenism, the framework established by the Greek physician Galen in the 2nd century. Galen taught that the human body was governed by 4 humors: blood, phlegm, yellow bile, and black bile. Disease was an imbalance of these humors, and treatment consisted of restoring balance through bloodletting, purging, and dietary adjustment. This system had dominated European medicine for over 1,000 years, and questioning it was close to heresy. Paracelsus rejected the 4 humors entirely. In their place, he proposed that the human body was a chemical system governed by 3 principles: sulfur, mercury, and salt. These were not the literal substances, but philosophical principles representing combustibility, volatility, and solidity. Health was the proper balance of these 3 principles, and disease was a chemical disruption that required a chemical remedy. This was the foundation of iatrochemistry, the application of chemistry to medicine. Paracelsus introduced mineral and chemical remedies at a time when most physicians relied exclusively on herbal treatments. He used mercury to treat syphilis, antimony as a purgative, and laudanum, his own preparation of opium dissolved in alcohol, as a painkiller. He understood that the dose makes the poison, a principle he articulated as, "All things are poison, and nothing is without poison. The dose alone makes a thing not a poison." This idea, now known as the dose-response relationship, remains one of the foundational concepts of modern toxicology and pharmacology. His approach to surgery was equally revolutionary. At a time when wounds were treated by pouring boiling oil into them, Paracelsus argued for cleanliness, natural healing, and the use of specific chemical preparations. He recognized that miners' diseases were caused by inhaling metallic dust and vapors, making him one of the earliest contributors to occupational medicine. His treatise on the miner's sickness and other miners' diseases, published posthumously, is considered one of the first works on occupational health. But Paracelsus was not merely a chemist or physician. He was deeply immersed in the Hermetic and alchemical traditions of his time. He believed that the macrocosm, the universe, and the microcosm, the human body, were mirrors of each other. Understanding the chemistry of the stars meant understanding the chemistry of the body. He drew on Neoplatonic philosophy, Kabbalistic ideas, and folk magic, weaving them into a medical and philosophical system that defied easy categorization. He wrote extensively about the invisible forces he believed operated in nature. He described the archeus, a vital force within the body that directed chemical processes and maintained health. He wrote about elemental spirits, beings he called sylphs, undines, gnomes, and salamanders, which inhabited the four elements and could influence human health and destiny. These ideas placed him at the intersection of science and magic, a position that made him both influential and controversial. His personality did not help. Paracelsus was combative, insulting, and relentlessly critical of the medical establishment. He called his colleagues wormy and lousy sophists, and claimed that the hair on the back of his neck knew more than all their universities combined. He was expelled from Basel after a dispute with a magistrate over a fee, and he spent the rest of his life wandering from town to town, treating patients, writing prolifically, and making enemies wherever he went. He died in Salzburg in 1541, at the age of 47, under circumstances that remain unclear. Some historians suspect he was murdered by agents of his professional enemies. Others suggest chronic mercury poisoning from his own treatments. His legacy is paradoxical. He was wrong about many things. His elemental spirits were fanciful. His chemical theories, while revolutionary, were often vague and unsystematic. He could be a charlatan and a genius in the same paragraph. But the core of his revolution was sound, that diseases have specific causes, that chemistry is the key to understanding and treating them, and that observation and experiment matter more than ancient authority. The Paracelsian movement that followed his death transformed European medicine. His followers developed new pharmaceutical preparations, built chemical laboratories, and challenged the Galenic orthodoxy in universities across Europe. The iatrochemical tradition he founded led directly to the development of modern chemistry and pharmacology. Van Helmont, Boyle, and eventually Lavoisier all stood on ground that Paracelsus had broken. He remains one of the most difficult figures in the history of science to categorize. He was a mystic who insisted on empirical observation. He was an alchemist who laid the foundations of modern pharmacology. He was a wandering healer who challenged the most powerful institutions of his time. He was impossible, and he changed everything.